In the United States, it's very common for a woman to go to the doctor and have the doctor tell her, "It's all in your head, it's just anxiety, don't worry about it." Two different doctors told my wife that about the same issue, and she almost died. Back in 2022, my wife had a grand mal seizure and was diagnosed with epilepsy. We went to a neurologist, and the neurologist prescribed her with something called Lamictal. Lamictal is a very powerful drug, which means you have to titrate up on it. You can't take the full dose immediately, you have to take small doses incrementally until you build up a tolerance. Usually takes about 3 or 4 months. If you were to take a full dose immediately, you could have extremely negative side effects, including death. So my wife's on this new medication and she feels unwell. Something just doesn't feel right. On top of feeling unwell, she's actually got a small rash on the top of her feet, and we're not sure where it's coming from. So we go to the neurologist. The neurologist takes one look at her and says, "It's all anxiety probably. You're on a new medication, it's very stressful, so anxiety and stress, no worries." "Okay, you're a doctor, so we believe you," so we go home. But the symptoms don't go away. They in fact get much, much worse, until one day I had to rush my wife to the hospital. She's in an ER bed and her heart rate is dropping dramatically. She's very disoriented, slipping in and out of consciousness, and every time she goes to pass out, her heart rate drops to 15 beats a minute. Alarms are going off, nurses are rushing in and out, doctors are coming in and out, but they can't figure out what's going on. Eventually, she evens out and she feels okay, her heart rate's back to normal, so they send her back home and they say, "It was probably just an anxiety attack, we're not really sure." Later that night, my wife takes her second dose of Lamictal, her second dose of the day, and these symptoms come back with a vengeance. She's in the bathroom throwing up on the floor and she can't move, so I have to pick her up and carry her to the car to rush her to the ER. As soon as I get there, they rush her back and do a bunch of tests. Come to find out, the neurologist prescribed her the incorrect dosage of Lamictal. So instead of titrating up slowly, she was taking a full dose of Lamictal twice a day. And this caused her to develop something called Stevens-Johnson syndrome, which is very bad and could be deadly. She had to stay in the hospital for, I think, 4 or 5 days straight and eventually came home and switched medications. The neurologist never acknowledged it though. He said it was the pharmacy's fault and the pharmacy said it was the neuro's fault. So we never really got an answer. But it was all in her head. Just anxiety and stress. No big deal.